So I'm going to introduce Caroline Williams, who is a project manager for strategic initiatives at the Community Foundation of Herkimer and Oneida Counties. But I'd also like to give a shout out for, you used to work with Cornell Cooperative Extension, which is another one of our partners. So we're really happy to have Caroline with us today as part of the Rust to Green team.
Well, as our presenters are kind of coming up and getting settled, a lot of the impacts that health has related to housing, environmental risk, life expectancy, all of those things have a direct impact, and the CDC has done a number of research items related to census tracts and life expectancy in those census tracts, based on your exposure to housing, built environment, and natural environment. So our three presenters today are going to be covering topics related to housing and health and wellness, to talk a little bit about how those impacts basically have an impact on social determinants of health. So I'm going to turn it over to Nancy Wells, and she's going to discuss a little bit about her research in how housing and environment influence health and wellness related to the built and natural environment.
Hi, people. Thanks for being here. I'm an environmental psychologist, so I'm interested in how the environment, both the built and the natural environment, affect health and functioning, psychological well-being, various aspects of health, kind of broadly defined. So today I'm going to give you a little snapshot of research evidence, really brief snapshot. So to talk about both how housing affects health and how the natural environment, particularly within the residential context, affects health, both physical health and mental health. So I've tried to just choose kind of some nuggets for you, because I could probably talk for a couple hours on these topics. I'm going to spare you that. So first, to start with housing and health. And some of my work has been with Habitat for Humanity. Some of these images reflect some of the settings where I've worked, looking at housing quality before people relocate and following them as they move into new housing through the Habitat for Humanity program. So to start, I'll say a little bit about physical health. I'm not going to focus so much on physical health, but when we think about housing and health, it's important to recognize various kinds of hazards that might exist within the home environment. So things like volatile organic compounds, which exist in paint and upholstery, and even in different kinds of products that we bring into the home, as well as things like asbestos and radon, which we refer to as legacy toxins because they persist in our environment. They're kind of with us for a long time, as well as radon, mercury, which might exist in fluorescent light tubes, carbon monoxide, which is known as the silent killer, right? It's important to have carbon monoxide monitors in our housing. Even things like pesticide residue, and of course lead and lead-based paint, which we'll hear more about later. So all of these hazards within the home can have various kinds of effects, from things like asbestos and radon are associated with cancer. Some of these other factors can be linked to various kinds of respiratory diseases and things like that. I also just wanted to touch on issues of injury within the home environment. So common causes of injuries within the home are falls. As you might guess, falls are particularly a concern with respect to older adults within the home environment, as well as poisonings, which we think of especially with respect to children, and then fires, burns, and scalds. These are the top three causes of injury within the home environment. And many homeowners don't know what temperature their hot water heater is set to, right? So scalds can be common, whether it's at the kitchen sink or in the bathtub. But I'm going to focus a little bit more on mental health issues. So one of the things that's comes up quite a bit in the literature, looking at the linkages between housing and health, is dampness. This is a key aspect of housing quality. And maybe you wouldn't be surprised to learn that we especially see that in the literature from the United Kingdom, a very damp place. So dampness is linked to things like anxiety, depression, and poor mental health. And as we see in the image on the slide, it also can lead to issues of mold, and which can have respiratory consequences. So both physical and mental health. The research on housing and health also focuses on different kinds of housing. So some of the evidence suggests that people living in high-rise housing are more likely to have poor mental health. And these studies do typically control for things like socioeconomic status and other kinds of predictors. So it's really trying to focus on the issue of the type of housing. And this has been documented as perhaps especially an issue for mothers with young children. So if you imagine living in a high-rise building, you might not be able to have your children play outdoors very easily. You might have kind of stress about supervising your children if they are playing outside and you're up in your apartment building. Other studies have looked specifically at floor level. So within a high-rise apartment, how are people on the second floor compared to folks up on the 15th floor? There's some suggestions similarly that it's floor height that's part of that equation. And then housing quality. So a lot of work has focused on housing quality, and as I mentioned, my work with Habitat for Humanity, it's this kind of unique opportunity. It's kind of hard to find situations where we have people moving, relocating, and to be able to look at their original housing, and then as it changes, how is that linked to mental health? So my colleague and I developed a scale to operationalize housing quality, and we looked at things like structural quality, maintenance and upkeep, physical hazards, and also crowding. So these things are associated with better mental health. So you might wonder what might some of the mechanisms be, especially with respect to housing quality. Why might housing quality affect mental health? So there are a few ideas. These come both from empirical evidence and theory. So the first is the idea of identity. So we think of housing as kind of a representation of ourselves, right? It's kind of a symbol of our identity. And if we live in a place that's kind of poor housing quality, we might have a sense of stigma, right? So it's a kind of an identity issue, might relate to then why it would affect mental health. Secondly, insecurity is a salient issue when we have folks living in poor housing. There's both the idea of instability, not being sure whether they'll be able to stay in that housing long term, and maybe worrying that they might end up homeless, as well as concerns about safety and sort of the quality of the environment, maybe worrying about kids' safety, that kind of thing. So a few different facets related to insecurity. Third is social withdrawal. So there's some evidence, I kind of alluded to this with respect to folks living in high-rise housing, that they might be a bit more socially withdrawn, right? The issue of being like way up on a high floor, kind of removed from the social scene down on the ground, might be related to this sense of social withdrawal that might affect mental health. But in addition, in terms of housing quality, there's some evidence that living in housing that's of poor quality might lead to social withdrawal, maybe related to a sense of shame, kind of tying into that idea of identity as well. So maybe you're less likely to invite folks over to your house for dinner if you're not feeling good about the environment you live in. There's also evidence that parenting might be affected by housing quality. So if you live in a place where you're worried about your kids' safety, you might have more sort of strict, restrictive parenting, and that might make both the kid and the parent stressed out, right, in a way that would maybe affect mental health. And lastly, control. So if you're a renter perhaps, and you're living in a place where the quality of the housing isn't that great, you might have a sense that you don't have much control, you don't have very many options, you can't maybe personalize the space even, and that could lead to a sense of helplessness, right? Kind of a sense of a reduced sense of self-efficacy, like feeling like you can't really make a difference in your own environment. So I wanted to kind of highlight these possible mechanisms so that we have some notion of what these pathways might be. Sometimes when we think about housing quality affecting mental health, it can sound a little mysterious or magical. So I think it's useful to kind of have a sense of those pathways. So I'm going to turn now to talk about the natural environment and human health. And I've kind of tried to choose a handful of my favorite studies, again, to not keep you for an hour. So first, in terms of physical health, there's a study done in the Netherlands looking at about 250,000 people. They found that the association between the percentage of green space near the home environment and perceived health was as shown on the screen. So, and it's interesting, we, as researchers, we're often cautious about things that are self-reported, right? So the idea of perceived health, but in fact, self-reports of health are quite valid and reliable, as it turns out. So we can feel pretty confident about this. So as you see, the more green space near the home, the fewer reports of bad health. And this study represents, the research looking at nature and health was really a lot of work was done in this area in my field, in environmental psychology, and in recent decades, I guess, the last 10 to 15 years, folks in epidemiology have been looking more at these concepts and looking at these big samples. So it gives us another perspective. So physical health is affected by proximity to nature. Another aspect of health that's influenced by nature is cognitive functioning. There have been a whole series of studies looking at cognitive functioning outcomes in terms of access to nature. And this is kind of a classic study that was conducted in Chicago public housing. And they found that for girls who lived in Chicago public housing, a view of nature out the apartment window predicted concentration. They're better able to concentrate. Also inhibitory control, so kind of this sort of related to cognitive functioning, being able to kind of hold back and inhibit, and related to that delayed gratification. And these all kind of translate to kind of operating in the real world when you're talking about adolescence and issues of drugs and other kinds of temptations in the world. These kind of translate in meaningful ways. A recent study in Denmark used longitudinal evidence, and this I think is really a powerful study. So they looked at children who, they looked at the environments that children lived in from birth to age 10 and found that the greener those settings were, the less likely the children were to experience psychiatric disorders as adolescents. And this is the first study that I know of that's looking at that kind of longitudinal evidence of the early childhood experience to a bit later in life, in adolescence. And again, as with these other studies, they controlled for kind of the normal things of family history of mental illness, socioeconomic status, that sort of thing. A study that my colleague and I did, Gary Evans and I did a while back, looked at the idea of resilience among children. And we found that for kids who had more nature nearby, near their residential environment, the effects of stressful life events on their psychological well-being were less profound. So we used this kind of stressful life events inventory for kids. You guys have probably seen the adult version of that kind of scale. So it's like, have you been picked on at school? Are you subject to peer pressure? Did your grandparent die? Did your family relocate? And we found that if they had more nature, there was less impact on their psychological well-being. So we see that in a graph here. And what I think is also striking about this finding, my pointer works, is that we see the greatest difference for the kids who have the highest level of stressful life events. Not so much difference for the kids with low stressful life events. So kind of that protective factor or kind of resilience mechanism. There's also evidence that the natural environment matters in terms of social connection. So another study done in public housing found that residents who lived in buildings that had nearby trees, illustrated in these images, had greater social cohesion. So they knew their neighbors, they felt more comfortable asking to borrow a cup of sugar, asking someone to look after their kids while they run an errand. they had more social support compared to the folks who lived in the buildings without trees. And in this study, these buildings were architecturally identical, so there weren't sort of clear confounding variables. And it just so happened over time that around some of the buildings the trees had died, and around other buildings the trees were still there. And there were two studies. One was done among adults, and the second with older adults, folks in their 80s and 90s. And a study in Japan looked at longevity. So in addition to these issues of physical health and mental health and cognitive functioning, maybe nature helps prolong our lives. So this study looked at senior citizens, looked at the environment that seniors were living in, and found that the best predictor of their 5-year survivalship, living 5 years later, being alive 5 years later, was having space for taking a stroll near their residence and living near parks and tree-lined streets. And related to that, another study, this comes out of England, looked at the role of nature in mitigating the linkages between income and mortality. So there are clear associations between various income groups or socioeconomic status groups and mortality rates. So what we see here, and I've kind of truncated the graphic to kind of make it a little bit simple, we see in group A, the least green group, we see the greatest differences in mortality across the income groups. Whereas in group E, the most green, we see much less difference between those income groups. So we see this kind of buffering of the effects of income or poverty, which kind of goes back a bit to this idea of the buffering notion of kids having the impact of stressful life events buffered. And this idea that nature might kind of mitigate the impacts of socioeconomic status or poverty has been referred to as equigenic. Sort of maybe nature has an equigenic effect in terms of health. So in that little thumbnail sketch, hopefully I've given you some evidence that housing matters. Housing and housing characteristics have an effect on physical health as well as mental health, and nature matters. Nearby nature, near the residential environment, is associated with a whole range of health outcomes, from physical health to mental health, cognitive functioning, and even longevity. Thank you.
Nancy ended up presenting really gives us a perspective on not only how housing affects the physical well-being of our community and is not necessarily equitable, but also gives us as community development professionals an opportunity to think about, as those things are happening and we're looking for community engagement, what some of those barriers might be to having people who need our help the most be able to participate in the engagement activities that we're looking to have them attend, as well as thinking a little bit about, as we're planning projects, as we're planning communities and neighborhoods and all of those things, to really incorporate green space and outdoor and nature to be able to give those advantages to particularly children that we want to be engaged in economic and educational opportunities.